Hi, my name is Kristy Williams. I want to thank you for giving me the opportunity to introduce myself and for being considered for employment at MedcoVet. I am a certified vet tech. I have been in the field for quite a long time. I got initially involved in the field back probably in the 90s. I was living in England, was married to a military man, was working on the base for the Army in the veterinary clinic. I was not Army, but I worked for them. And I sort of got just thrown, got really attached to it and got really interested in it. I was hired as reception office work, but they couldn't keep me out of the back. So I would go up back when we weren't busy out front, and I started learning and started realizing that that was really where I wanted to be doing. I was fascinated. I think the field is so interesting. There's something new every day. You're always learning, you're always growing. And that was what I realized. Came back to the States in 2001 after getting a divorce and worked at a vet clinic here in New Hampshire, and realized that I wanted to keep going. I wanted to keep learning. So I started going to school while I was also working full time. Earned my certification or my certified vet tech license in 2005 and have been working in the field up until probably about 3 years ago. And I do just love it. Like I said, it's something that I think you get hooked and it's hard to walk away. I did walk away because my body was getting a little tired of crawling around on the floor restraining dogs. And I really have a passion for canine fitness, for training, and a special interest in rehab. So I wanted to try to do some of those things. So what I did was I took a job in a moving company that I knew I would have time for learning other things while I was there. So I, about 5 years ago, got my certification in canine fitness through the University of Tennessee. And now I am currently enrolled in Canine Professional Certified Fitness Trainer. Used to be a course that was run through Fenzi Dog Sports Academy. It's now run privately by Deb Taraka, who owns Wizard of Paws in Connecticut, and Tara Monahan, who I think is in Canada. I'm finding this program to be so much more comprehensive and really fascinating and interesting. It's intense. There's a lot of work to it, but I'm really enjoying it. And I feel like it's something that is just going to better my abilities, my knowledge in the field. In my opinion, it is. I took all of the courses for the rehab program through the University of Tennessee. I was managing an animal hospital. I just didn't think I had the time to put towards getting my certification or my license in rehab. So this course that I'm taking now, I feel like is a step below that, but it's pretty comprehensive. So it's not rehab. Obviously, we're working with healthy animals, but it's pretty close. And I'm finding that the methods that she's teaching and that we're talking about and the anatomy that we're talking about, it's all incredibly interesting. Some of it's not new, but it's a good refresher. A lot of it is new, and learning that the things that we can be doing with these animals doesn't have to be rocket science. We don't have to have them, hanging off of equipment to get results. It's been really interesting. I would describe photobiomodulation to a prospective client as a low-level laser or red light therapy. It is a non-invasive treatment that uses low-intensity light to help stimulate cell reproduction. So it helps to increase cell metabolism, to promote healing, to decrease inflammation, which in turn decreases pain. It's non-invasive, so it can be done with the client sitting right there. It can be done by the client. I think it's a fantastic treatment for dogs and cats, probably even better for cats because there's so few medications that you can use on cats. But for those dogs that coming out of surgery, I worked at a hospital that we used to do it on every single incision, and it really did make a difference. We saw so few animals come back with problems with their incisions. Dogs that are post-op orthopedic surgeries. If you start getting them having laser therapy right away, you bring that inflammation down, you increase the healing. Those older arthritic dogs that are already on NSAIDs, but they're still kind of sore and the owners want to do something, it's such a great source. Again, that same hospital, we did a lot of old arthritic dogs. They would come in for laser therapy. The problem with it was, once a week, twice a week. And they had to get these big old dogs in the car. And then they had to get the big old dogs out of the car. Some of them were a little bit anxious about being at the vet. So the thought of being able to help these dogs have this treatment at home is huge. It's huge. The cases that I would be very cautious of or tell people to not use it on, if I knew that there was a cancer diagnosis, obviously, nope, don't use it. If there was a suspect, so if I had, I don't know, say a 5-year-old Rottie who was lame and there was a little bit of swelling around, where they were lame, so on their right thigh, there was a little bit of swelling, I would absolutely caution them or tell them not to use it and to see their vet, because there could be something a little bit more sinister going on than just some soreness or inflammation. So anything that is cancerous or suspected cancer, they shouldn't be using it. I think that's it. Again, thank you so much for your consideration, and I hope to hear from you soon. Thank you.